Welcome to the Independent Sage Friday briefing. In just over 1 week's time, the government is planning to lift all the remaining lockdown restrictions, including rules on mask wearing, social distancing and limits on gatherings. This is in spite of the fact that the Health Secretary, Sajid Javid, has warned that we can expect to see around 100,000 infections per day this summer. Independent Sage has repeatedly called for both improved mitigation measures and a competent find, test, trace, isolate and support system. Lockdowns have been terrible for so many. We're aware that repeated lockdowns are a contributing factor to the nationwide rise in poor mental health. And that's just one of the reasons why we believe we should take all the necessary steps to restrict the spread of the virus so that we don't have to resort to the blunt instrument of lockdown again. The rise in poor mental health that we've seen is a devastating consequence of the pandemic for many, and particularly for young people. That's why today we're hosting a special session on mental health in young people. So here to join us, we have Professor Tamsin Ford, who is Professor of Child and Adolescent Psychiatry at the University of Cambridge. And we're also delighted to welcome back 17-year-old Alma Jubaili, who some of you might remember joined us back at a briefing in January. So welcome Tamsin and Alma. We're going to hear more from both of them shortly, but first of all, we're going to go to Professor Christina Pargle for a quick run through of the latest figures. Christina, over to you.
Thank you. So just a very quick tour through the main numbers so that we can get on with hearing from our guests today. So I'm just going to go through quickly cases, hospitalizations and vaccinations. It's not great news, basically. So cases first. This is the number of new UK confirmed cases by reporting date, so people who've had a positive test. As you can see, this has been continuing to increase this month. We're now at over 30,000 cases. For some reason that isn't showing up here, but we are now over 30,000 cases and still rising. If we look at the number of cases for each UK nation, this is per 100,000 people per week, so you can look at each nation together. We can see that it looks like, thankfully, Scotland seems to have peaked and is now starting to fall slowly, so I think that is good news. But the other nations are all still increasing. Growth in England has slowed a little over the last week. It's 41% increase last week compared to 70% the week before. But Northern Ireland and Wales are still increasing rapidly. And this pattern is also seen in the ONS survey, showing increases in all nations. And they only go up to the 3rd of July, so they still see Scotland increasing. Looking at English regions, all regions are going up. What is really noticeable is that the Northeast is seeing a really significant surge, now have far higher case rates than the rest of the country. And what that means is, although cases in the Northeast are highest in young adults, they're growing up in all age groups, and particularly even you can see now a big rapid increase in the over 60s here, where cases are climbing, and they're climbing to kind of levels that we saw in the November, October peak that we had. So unfortunately, although vaccines are very protective, they're not perfect, and not everybody has the protection from vaccines, whether because they haven't been vaccinated or because they are vulnerable in other ways. And so it is now going over into older age groups as well. The Imperial REACT study published an interim analysis yesterday. So they test about 500,000 people every, 150,000 people every month. And yesterday they released the first 50,000, and they're showing again a big increase across all ages in the country, but highest rates again in young people. And what was interesting this time is that overall they're seeing more cases in men, quite a few more cases in men over the last month, whereas in previous months it's been about equal numbers. And so they hypothesize that this is an impact of people getting together and watching the European Championships. So, while it's been amazing to watch recently to watch England do well, unfortunately, it does seem to be coming with higher COVID transmission. Just looking at hospitalizations, they're still much, much lower than they have been. That's really good news, but they are going up in every country now. This is just looking at England hospitals to the 30th of, actually this is to the 6th of July. So yes, we're still much lower than we were, but we are now approaching 500 admissions a day and going up. Hospitalizations increased by almost 60% last week. Looking at the regions, again, they're going up in every region, particularly steeply in the northeast. And we should expect that to continue, particularly seeing the increase rates in the over 60s there, but also going up particularly rapidly here in the Midlands. And finally, just looking quickly at vaccination data, we're making progress. You know, more than 50% of people now have been fully vaccinated, but we still have almost 15% who do not have the full protection of 2 vaccines, and about 30% who've not been vaccinated at all, including children. And the rate at which we're vaccinating has been slowing for a while, and it is continuing to slow down. So we're seeing a big drop in second doses. Now, that's not necessarily that surprising because we're picking up these first doses here where we were doing far fewer first doses, but we're also seeing steep drop-offs in first doses. And just yesterday, there was an article in The Guardian about how vaccine uptake is going down, particularly first doses, and particularly in young people. And health chiefs are quite worried about this kind of lack of demand among young people. And I mean, in some senses, it's not that surprising. You know, the government messaging this week has been that young people are fine if they get COVID, and we shouldn't be worried about high infection rates. And so in a sense, if the government is saying they don't really mind if you get immunity through infection or vaccination, then why would we expect young people not to listen to that and not come for their vaccine? And we're also seeing the ethnicity differences that we saw in the over 50s for first doses carry on in younger age groups, in fact, be more pronounced in younger age groups. So, you know, over 80% of people under 18 who are white, over 18 who are white have now had a first dose compared to only 50% of Black minority ethnic people. So, you know, we can see a big difference there. And again, that is quite concerning. And I think on that, I am going to end and move over to the main session. Thank you.
Thank you very much indeed, Christina, for that. So now we're going to speak to our special guests, Professor Tamsin Ford and Alma Jebali. So I'll hand over to you, Tamsin, first to introduce our subject for today.
Actually, I'm going to introduce them. Sorry, I should have said Alice.
Over to you then, Susan.
Thank you. Okay, today, as has been said, we're going to focus on the mental health of children and young people. Young people's mental health has been deteriorating over the last decade, and so was not in a good place when COVID hit. UK data suggests that last year, 1 in 6 children were struggling with poor mental health, and the picture is similar for those aged 18 to 24 years. They're paying a heavy price with poorer educational, social, and health outcomes. And for many children and young people, problems persist. So I'm delighted to welcome our guest, Professor Tamsin Ford, who is a psychiatrist and clinical researcher from Cambridge. And I'm also delighted to welcome Alma Jebali, who has recently left school and has experienced firsthand the problems that COVID has brought, both to her family and friends. And Alma has come with some questions for Tamsin. So over to you, Alma. Thank you.
Hi, nice to meet you all. So in terms of settling back into school after COVID, my 11-year-old brother, who is autistic, found it very challenging adapting to all the changes that COVID has made in schools, such as the social distancing that's been taking place and the self-isolation periods. And that has led to his mental health suffering tremendously, and he was left more anxious and vulnerable than before due to all the changes that were happening in the school, and he just felt really like the uncertainty was really getting to him. And we felt as his family that there wasn't any support measures being put in place to help him at that crucial time. So what I fear is that the same thing happening when children go back to school in September, or even transitioning into the summer holidays. So my question is, what would you think all this disruption and constant change in atmosphere will have on children and their families, especially those with neurodivergent background like my brother?
Well, thank you, Alma. That's a really important question. There is an amazing, in fact, heroic living systematic review being conducted by a team of mental health researchers at McGill University. And when I last checked, they had screened over 55,000 abstracts since the beginning of March last year, looking at the evidence of the impact of COVID on mental health for people of all ages. Only 100 studies were good enough. So we are facing starvation in the midst of plenty. There is a very high signal to noise ratio with a lot of very poor studies and confusing findings. And worse than that, under 10 of those studies relate to children and young people, and we have a particular data gap for those under the age of 16. We're doing better for emerging adults, so 16, 17, 18 into the early 20s. The evidence overall suggests that lockdowns and being out of school are particularly bad for youngsters' mental health. So there's a very interesting study across 10 sites in the USA, one in Peru and one in the Netherlands, which demonstrated that mental health symptoms, particularly depression, but to a lesser extent anxiety, were worse where lockdowns were very strict. So I think the disruption is particularly difficult for young people like your brother. One of the characteristics of those who have an autism spectrum condition is struggling to manage change. So even things that the rest of us take in our stride, like the clocks going back or half terms, let alone long unexpected periods out of school, are very difficult to handle, particularly then going back into school, which is not the same school situation as they left because of bubbles and tests. And, there are some people who will really struggle with that. There will be others who going back to school will be an absolute blessed release because suddenly they're able to see their friends and they've got more structure to the day. And so I think we need to be careful when studies don't seem to show much across the whole population of young people, because within that there will be groups who are doing particularly badly. And I think in the adult literature, one of the groups that's doing particularly badly is parents with young children, which I'm sure is about trying to juggle homeschooling, working, and looking after themselves. And for some families, the resources they have just mean that that's almost an impossible ask. That's important because if parental mental health is poor, they are less able to support their children to cope, and that is likely to have a knock-on effect on children's mental health.
Yeah, I completely agree. And to do with what you said about different people responding to the changes differently, do you think there are any specific groups that we should be particularly worried about?
Yes, I do. There is a very strong link, not only in the pandemic, but also in the data we do have for the pandemic, about financial stresses and mental health for both adults and children. So in the data that Susan talked about at the beginning, the 2020 survey, which was a very carefully constructed survey to be representative of the population of school-age people in the UK, those whose financial circumstances had changed, those who were having to go to food banks, those where families were struggling to meet household bills, they were much more likely to have a probable mental health condition. And likewise, in the adult longitudinal surveys, the group who are either deteriorating in their mental health or demonstrating a sort of sudden drop that's been maintained in how they're doing with their mental health are far more likely to be living in socioeconomically deprived situations. Another group is those with special educational needs. So not just those who are neurodivergent, but for those who have additional needs at school, who I think have really suffered during lockdowns, and by the nature of the fact that they have additional educational needs, are going to need more support to catch up than other children. And authorities were struggling anyway to put that extra support in for children.
Yeah, definitely. And I've seen that definitely with like my brother's case. It's been very tough for a lot of those children. And in terms of like my friends, from talking with them like over lockdown, I've noticed how everyone's mental health have decreased, and more people I know have started suffering from things like depression and loneliness as a result of all the academic stress, but also from the social isolation that's been put on them like during this COVID times. And a lot of them have been left so alienated and fed up over the course of the year. And even when they tried to find help, a lot of the times they had to put up with like long waiting lines and times. And so have been left feeling disregarded and neglected by the government with the lack of support available for them. So in terms of like your opinion, what view do you have about how to best help young people like my friends like cope with these sort of issues?
Well, I think it's a really important question, and I think we need to respond at a number of levels. So there are things that we can do at a kind of societal level. So absolutely, we should be supporting families to cope financially, to cope with housing. The practical supports that were put in terms of furloughs, in terms of increased benefits, in terms of free school meal vouchers over the summer holidays. All of those are really important safety net. I think we should worry less about the academic catch-up at school and more about settling people down emotionally and helping them build their mental health. We are social animals as human beings, so actually not having contact with your peers, particularly for preschool children, developing the skills to be able to cope with school, but also for those in adolescence where peer relationships are how you define yourself. Those are kind of two critical periods of development that have been really disrupted. And it may be that people are going back to schools where their friendship groups have really shifted, because we all grow and change over time. And that's why sometimes friendships fail and others spring up. But that's normally a process that happens gradually, and you see each other every day, where people haven't seen each other for months, perhaps. People are probably going back into peer groups that have drastically changed, particularly at the fast periods of development. I'm not aware of studies of this, but I have heard from educational colleagues that actually friendships and friendship groups and sudden shifts have been a real issue. And that's really important, because one of the things that predicts the persistence of mental health conditions over time is problematic peer relationships. So I think there's a really strong role for schools and community groups about helping children and young people to build and develop strong, positive peer relationships, and to help people with the skills to structure their time and to make sure that they do everything to help them sleep well. Sleep is a hugely important factor for your mental health and for all kinds of health. And it's one of the things that we've had lots of reports from lots of different studies has been particularly disrupted for young people with the loss of structure. And then we have woefully underprovided historically for children and young people in terms of mental health services. So people would say that mental health services are the Cinderella service for the National Health Service. Well, children's services within that are a Cinderella service. And it's really telling at the moment. So I think we've been hit by a triple whammy. First of all, the stress of the pandemic has massively amplified a process that was sadly going on over the last decade of deteriorating mental health. Secondly, because budgets have shrunk over the last decade, a lot of third sector organisations or other organisations like schools that don't have a formal mental health brief were actually doing lots of really fabulous work in that space. And they've had to retrench back to their core purpose. So we've got rising demand and shrinking supply. And whilst I'm aware we can't magic up clinical psychologists and psychiatrists, and we really need to think smart about how we train people up to deliver evidence-based treatments to more children, because to use my grandmother's term, a stitch in time saves nine. Young people with poor mental health pay a very heavy developmental price, and probably arguably more so than somebody in adulthood who has the same problem.
Yeah, well, thank you so much for that. It's like, just hearing that alone just makes me feel that, we're just being like, our voices are now being heard, and like we've identified that there is a problem and that it needs to be solved. And to conclude, what do you think that we should be doing about all the mental health conditions that children and young people are suffering from at the moment?
Well, I think, I've talked a bit about the kind of public health interventions, the community and societal level things. I think we need to support those in contact with children, so nursery nurses, teachers, teaching assistants, to be able to differentiate between persistent mental health conditions and more minor problems. I've done work that shows that teachers are really good at picking out children who are doing fine, and they're absolutely right when they say a child is not doing fine, but they're not very good at being able to differentiate what is a severe clinical problem from what is a more minor problem. And why should they be? It's not their job, but there are simple things we can do to help them do that. We need to train up more people in sort of transdiagnostic approaches that are evidence-based. For example, I have a colleague, Ros Shafran, who's doing work in Greater Ormond Street, training up epilepsy nurses to use a simple CBT manual that can pivot to what the family feels is the problem. And the epilepsy nurses love it, because they say, actually, we were doing lots of this, but we come from a physical health background, and we were doing it without training and without supervision, and we now have a framework. Now, we don't yet know that it's effective. We have to wait for the trial, but the signs are things like that could be hugely effective, and we need to facilitate those fabulous charities that are working in this space, like Place to Be or the Charlie Waller Foundation. There are lots of people doing massively good mental health work who need our support and funds at the moment.
Thank you, Tamsin and Alma. That was a really excellent and informative conversation. And I think you've both really outlined the nature and the scale of the problems that young people are facing now. Tamsin, I just wanted to ask, if you were in charge, we've got 2 months of summer holidays, we've got going back into school under whatever circumstances, we don't know, but they might not be ideal. What would be the sort of top priority practical things that you would ask the government to enable to happen to minimise the worsening of the problems, mental health problems facing children, young people, and hopefully improve them?
Keep the increased benefits and free school meals for the most vulnerable, and lots of activities for children of all ages during the summer holidays. For lots of families, although we probably all look back on the summer holidays when we were at school with fondness, actually for lots of families, particularly the parents, they are a really stressful time. But also that would allow schools and youth centres to help children sort of rebuild structure to their lives, renegotiate their friendship patterns, and do some of that emotional well-being catch-up that needs to be done, to mean that when they go back into school in September, actually you're not dealing with unsettled children who don't know who their friends are and can't learn very well. They're more receptive to learning at that point. Those would be my 3 priorities, and if I can be greedy and have a 4th one, let's expand the mental health workforce, whether it's within CAM services or within the third sector or within schools, or preferably all of the above, because there's lots of work to do.
Thank you. Alice, do we have 5 minutes in case anybody else on the panel wants to ask a question of either Alma or Alice, or do we need to move on?
No, I think we can fit in a couple of questions if anybody on the panel does want to ask our special guests anything, and then we'll move on to questions from the press. So yes, is anybody on the panel wanting to ask a question at this point? Professor Carl Friston.
Thank you, and thank you, Alma and Tamsin. That was most illuminating. I've heard you talk about a very particular issue, very specific to this epidemic, which is the guilt and the uncertainty that children may feel about infecting their parents. You know, if you'll remember that pernicious meme last Christmas, kill a granny at Christmas. I'm wondering, was that the right sort of message and the right way to handle it? And is that kind of guilt a source of stress and unpleasantness for children? And if it is, how can we or the government sort of frame the problem and sort of message the right what you should be worried about and what you should not be worried about?
Well, thank you for raising that. That is another potentially vulnerable group. So the children who are either carers, and there are sadly plenty of them, or they have a grandmother or a parent who's immunosuppressed or vulnerable for some reason, have often been really frightened of bringing COVID into the house and in being responsible for their parent becoming ill. And, I'm aware in my own personal circle of somewhere where that has happened. Fortunately, the mother recovered, but she might not have done. She was very vulnerable. I think the way I would advise people around such a young person to deal with it, and that could be a teacher, it could be a relative, it could be anybody, is to sit down and consider the risks and what you can do about the risks in a very calm way. And actually for some, if the risks are extreme, if someone's really immunosuppressed and really vulnerable, well then, maybe the family should be shielding still. But if not, there are things that you can do in terms of, face, space, masks, all that simple attention to mitigations, trying to keep your distance from people, trying to make sure that the majority of contact is outside, and doing what you can to control the risks. And I think it's about helping young people to get their anxiety in perspective and to focus on what they can control. And for some of them, when it tips over into a disorder, because actually, let's not forget that feeling anxious and sad about things are normal emotions. It's just that if they are persistent and they stop you getting on with your everyday functions, then that is the point when they're becoming a disorder. Then there are techniques, simple techniques that you can teach people to handle their anxieties, like, try and center yourself by looking around and counting 5 things that you can see and 4 things that you can touch, and 3 things that you can smell and something that you can taste. And whilst you're doing that, your brain can't then concentrate on being anxious. And there are other techniques like, having almost like a mantra, a coping self-statement that you say, and being aware of your breathing and doing what we call square breathing. So when you get frightened, you tend to hyperventilate, whereas if you breathe in counting to 5 or even higher, and then hold your breath for a bit and then breathe out slowly, you can regain control of your breathing, and that will calm everything down. So there are lots of simple strategies that you can do with young people to help them cope.
Thanks. And Alma, would you like the last word, either on what Carl's raised or anything else?
Well, in terms of mental health, as a whole, something that I would say is that I would really appreciate if all this talk gets actually turned into action, because from the last time that I spoke, I did talk about my brother and things like that, but I haven't really seen any sort of course of action being taking place. And I appreciate you all like listening to like what I have to say, so thank you all for that. But yeah, like representing young people, I really do hope that something does change and for the better.
Well, thank you, Alma, and thank you again, Tamsin. Well, a lot of people do listen to this, and I think what you said is very powerful about what the problems are and what needs to be done. And I hope that people listening to this will think about ways in which they can either help their own communities or maybe put pressure to try and get the kind of support that everybody needs. And if there are any young people watching this, I think a really important thing to think about is that you're not alone, and do connect to somebody else. There is help out there. It may not be easy to get, it does exist, and persist and don't give up. So thank you both very much, and I'm delighted you can stay around for the rest of the session in case there are other questions from the press or public that you want to contribute to. Thanks, Alice.
Yeah, that's great. Thanks, Tamsin and Alma, for all of that, and for staying with us for the rest of the briefing too. So this is the point where we move to taking questions from the press and the public. And I'd like to invite the first questioner in, Adam Vaughan of New Scientist. Adam, what's your question?
Hi all, thanks for doing this as always. I just wanted to, we've heard a lot about living with COVID in the last week or so. I had sort of two questions on that really. One was what happens if we do get to 100,000 cases a day, as Javid has said. What does that mean? So, you know, can the UK cope with the sort of hospital admissions and disruption that will come from that level of incidence? So that was the first question. And the second question was, we talk a lot, understandably, about high-risk groups. I wondered, for sort of people who are in lower risk groups, i.e. people who are younger, people who are fully vaccinated, what will life see, you know, if we are to live with COVID, will life seem relatively normal for those people, or are their lives still going to be impacted in indirect ways? I appreciate that last one seems like a slightly odd question, but it's a particular area I want to look at because we've done a lot on the higher risk before. Thanks.
Thank you very much, Adam. Well, we've heard quite a lot over the last 24 hours of the response from the scientific and medical community to the plan for the 19th of July. But who would like to start with the first part of Adam's question about the potential impacts of that? Dr. Kit Yates.
Thanks, Adam. And just in terms of the 100,000 figure that Sajid Javid put out, he was then asked, you know, what does that mean for hospitalizations based on that number? And he said, we haven't put a number on that yet. But, you know, it's very strange that, because given the government's priority has always been about protecting the NHS, it's bizarre that you would allow an unspecified number of hospitalizations to occur without even thinking about what sort of pressure that puts on. At the moment, we're seeing maybe between 3 and 4% of cases turn into hospitalizations. So we could be talking, if we do get to 100,000 cases a day, looking at maybe 3,000 hospitalizations a day. And that's clearly going to put pressure on the NHS. People are talking a phrase that I've never heard before, which is a summer surge, a summer NHS surge. We hear about winter surges all the time, but a summer surge is sort of unprecedented. And this is at a time when we're already dealing with an enormous backlog of routine treatment that people have missed over the course of the pandemic. And I think people forget, and we need to emphasize this fact all the time, that the point of restrictions and mitigation is precisely so that we can relieve pressure from hospitals. It doesn't stop people getting treatment. It's so we can keep pressure off hospitals so that we can have routine treatment and get over that backlog. So certainly with 100,000 cases a day during the summer, we're going to be seeing pressure put on the NHS and routine care being cancelled. We're already seeing that happen, actually.
Yes, thank you for that, Kit. There have been some news stories about that this morning. And Dr. Zubaida Haq.
At the beginning of this pandemic, we were told that we were all in it together and we were weathering the same storm. But it's quite clear, Adam, that this pandemic has been anything but a pandemic of inequality. And although we've all been weathering the same storm, we've definitely not been in the same boat. So when the Prime Minister says, you know, that we can live with COVID and we're all going to be living with COVID, what he really means, or what it actually means in reality, is that there will be a very uneven impact of living with COVID, and that some people will be much more exposed, much more vulnerable, and much more underprotected with living with COVID. And we've seen that with people in more disadvantaged areas being 2 times more at risk of being hospitalized and dying from COVID. We've seen that with different ethnic minority groups, with Black and Asian groups being particularly vulnerable to COVID. But we have heard at Independent Sage, we have been overwhelmed with desperate cries from people from clinically extremely vulnerable groups as well. We know they are absolutely terrified of the phrase living with COVID, because for them, living with COVID essentially means that they have to just close the doors and be shielded and not be able to be outside. And then, of course, there's all the people on the front line, the transport workers, the people in hospitals, the cleaners, the social care workers, supermarket people, everybody, all those frontline workers that we have relied on are yet again going to be in the front of this pandemic and going to be overexposed. So when the Prime Minister says we're living with COVID, what he really means is that some people will be living with COVID and others won't.
Thank you, Zubaida. Professor Martin McKee, you'd like to comment as well here.
Yeah, thank you, Alice. I think one of the things that surprises me most is the lack of curiosity that ministers seem to have. It's really very easy to get an idea. Obviously, the numbers will not be precise. You can just simply put the numbers into an Excel spreadsheet, as I've done, and look at what happens if the number of cases and the number of hospitalizations increase at the rate that they've been increasing over the last few weeks. Now, of course, at some stage they will peak, other things will happen, and we know all of that. And that's why modelers do very sophisticated models. But you can get a pretty good idea of where we're heading. And clearly we're heading to, well, probably quite a bit more than 100,000, but we can calculate the number of hospitalizations. And as Kit said, it is quite a lot. So quite why, when the Prime Minister, when the Health Secretary and others are asked, why they don't ask somebody to do these sums for them, because they're pretty easy to do. The point about living with the virus, what again is this lack of curiosity, where nobody seems to be particularly interested in what it means for different people within society. Now, previously, we have talked a lot about co-creation, co-production of solutions. And throughout the work of Independent Sage, we've been listening to people. Many of you contribute to us on email and in other ways, and we hear what you say, and we try to understand what these things mean in practice. So what one of my colleagues in health systems research says, you know, what do you do on a Thursday morning when you go to work if you're talking about a healthcare reform, that sort of thing? What are the practical issues? And what does it mean if you are from a minority ethnic population in a multi-generational house where you've got several relatives who are working in a garment repair business or something like that? What does it mean if you're a school teacher? What does it mean if you're a healthcare worker? What does it mean for all of these people? And it's not difficult to go and talk to people and work through with them to try and understand the scenarios and the challenge they face. And then we might know what living with the virus means, rather than using it as yet another slogan, which is frankly meaningless.
Thank you very much, Martin. I wonder if anybody wanted to pick up on the second half of Adam's question. I've got interest from quite a few people. I'm going to start with you, Gabriel, so Professor Gabriel Scally.
It's a good question, Adam. One of the characteristics of this whole handling of the pandemic is that we have concentrated very much on people who are deemed to be at high risk and neglected all of the others who are medium or low risk. And this creates something called the prevention paradox. And that is, if you concentrate all your effort on identifying high-risk people and dealing with high-risk people, but at the same time, you allow lots of other people, lots and lots of people who are at moderate or low risk to be infected with this dangerous virus, you actually create a big burden of illness in its own right. So it's not all about people who are at high risk. It is about those medium and low-risk people, particularly now that the government has throwing petrol on the fire of the virus by relaxing constraints and failing actually, to provide the materials that we need to put out the fire through not doing anything about ventilation, not providing us with a decent find, test, trace, isolate and support system, relaxing quarantine measures. All of that is all going the wrong way. So it has big implications, I think, for very many people at moderate and low risk. Will the NHS cope? Yes, the NHS will cope. Of course, the NHS copes. It's what it does. It copes in emergencies. The NHS has coped with gross underfunding. It has coped with massive understaffing. It has coped with poor facilities and tremendous underinvestment, as we've heard in terms of mental health services. So the NHS will cope in an emergency, but it's all the rest. It's all of us who pay the price for that ultimately. NHS staff, because they get burnt out and stressed and become ill themselves, and all of us in terms of our health. Going into this pandemic, the health of the population was in decline. Life expectancy stopped improving in this country at about 2012 and hasn't got any better since. And for some people, particularly women and particularly those in the most deprived communities, the health is getting worse and has been since 2012. So yes, the NHS will cope, but we will all pay the price.
Thank you very much, Gabriel. And I'm aware there's quite a few people that want to answer this, but also there's a lot of other questions to get through. So, but I'm going to invite you to speak very briefly to this. Professor Stephen Reicher, you wanted to comment.
Yeah, the conversation you're suggesting we should have, Adam, I think is absolutely critical. How do we, now understanding the risks of COVID, decide how our society should be organised? After every other pandemic, or whenever we've discovered a health risk, we have that conversation. We have a sensible conversation about what are sensible mitigations which don't restrict us too much. So when we begin to have evidence of road fatalities, we begin to talk about speed limits. We begin to talk about seatbelts and drink driving. They're not fundamentally taking our liberty away. In fact, they're taking away people's liberty to destroy the lives of others. And similarly, that's the sort of debate we have to have now, but it's been stopped, and it's been stopped by this ridiculous rhetoric and this ridiculous binary between lockdown and liberty. So let's take the example of masks, which is central to the debate. Now, let me say, like many people, I hate wearing masks. I find them unpleasant, uncomfortable, and they steam up my glasses, so I bump into things as I walk around. But by no stretch of the imagination are they lockdown. I'm not locked down. I can go out where I want. They're a hassle, but they're not a lockdown. However, if I don't wear a mask, then for people who are vulnerable and for people who could get infected, they no longer have choice. They can't go out. They can't go into shops where people aren't wearing masks. They can't go into pubs and restaurants where people aren't distanced. They have to stay at home. So they indeed have their liberty taken away. They indeed are locked down. And so the balance seems to me that what you're asking me to do in wearing a mask is not much more than wearing a seatbelt, but what you're achieving through that is actually genuinely protecting people, creating a freer society. And I think we need that type of debate. What are proportionate measures which preserve as much as possible our freedoms, but at the same time keep us safe? And as I say, the binary between lockdown and liberty, whereby any measure at all is called lockdown and taking away my liberty, it becomes a moralized, it becomes an extreme, it becomes an intemperate argument, gets in the way of the sensible conversation, which, as you say, is absolutely critical for us going forward.
Thank you very much, Stephen. And I know that Christina wants to comment briefly as well.
Yeah, just on a personal point of view, over the next few months when cases are going to be really high. So I've had 2 doses of Pfizer, I'm at low risk. I'm personally not particularly worried about catching it for me, but I'm very worried about passing it on. We know that people who are double vaccinated can catch it, can pass it on. Both my parents are extremely clinically vulnerable. They've been shielding. I don't have that much faith that they would necessarily be safe if they caught it. And they've also suffered from not being able to see their family as much as they wanted. So I want to see them, and I'm not going to do that as freely with these high cases. And because I'm worried about getting it, I'm not going to go to the gym. I'm not going to go and eat in a restaurant. I'm not going to do all these things that actually I really, really want to do, because I don't feel that I can be a safe member of society when we have 100,000 cases a day. So that is my perspective, that actually, you know, I may not be at high risk, but I can be at high risk to others, and that will change my behavior. And I'm annoyed about it. I'm angry that we're in a situation where we're forced into this kind of decision making. So that's it for me.
Thank you very much, Christina. I mean, that is clearly the case, isn't it? That we are all a lot safer, you know, whether we're vulnerable or not, we're all a lot safer if there are low cases in the community. So allowing cases to spiral out of control is devastating. Thank you very much for that question, Adam. And hopefully you've got those very comprehensive answers there, and it sparked a lot of interest and discussion. So thanks. Next up, Nigel Nelson of the Sunday People. Nigel, over to you. A nice, simple, short question, please, Nigel.
Short. I'll follow up to what Kit and Martin were saying. If it's so easy to predict hospitalizations on 100,000 infections, so Kit says 3,000, presumably you can do the same thing for deaths. How many people within those 3,000 are likely to die?
Thank you very much, Nigel, because that was right to the point. Can we do that as well? Do we know what proportion of people are likely to be dying at the levels of vaccination that we've now got in the country? Kit, is this one for you?
Yeah, I can attempt to answer this. I don't think the calculation is quite that simple. So I suggested for 100,000 cases, you might see 3% of those becoming hospitalized. That number, 3%, is changing. It has, back in the first wave of the pandemic, it was up much higher than that, seeing maybe 12% of people who were getting cases, were going to hospital. Now with vaccination, that's decreasing. So it was about 4% a couple of weeks ago. It's probably about 3% now. It may continue to decrease a little bit as we vaccinate more people. And the same thing is happening. The same thing's happening with deaths. To some degree, though, the prediction depends on how many people we get vaccinated and with what type of vaccines. And actually, to get accurate figures, I think you really want to be doing some more precise modelling than back of the envelope calculations. That's not to say that the government don't have access to that sort of modelling, though. They absolutely do. It's not always in the public domain, the models that are being put out by SPI-M, but the government certainly have eyes on those sorts of figures. So I think for Sajid Javid to come on the radio without those sorts of numbers, when it's clearly a key criterion for whether we should release restrictions, is not really good enough.
Thank you very much, Kit, and also some further suggestions that actually figures may be even harder to get hold of, the ones that we have been able to get hold of recently. Does anybody else want to tackle Nigel's question, or do we feel that we've dealt with that one? I think we probably have. Thank you very much, Nigel. Christina.
I just wanted to say the other big unknown as we go into the summer is the effect of vaccine waning. So there have been various lab studies that have come out over the last couple of weeks that have shown that 3 to 6 months out from second dose among vulnerable older people, you do see a waning antibody response. Now, we don't know what that means in practice, but we're now at that situation where our most vulnerable were double vaccinated back in March and April. So that it's just an unknown, but it's something that just adds another area of uncertainty into it.
Thank you very much, Christina. Thank you, Nigel. The next question is one for me to read out. It comes from Divya Srivastava. Are there any legal routes here to stop the government's plans to lift restrictions on the 19th of July? So obviously Divya is interested in trying to stop that happening. Are there any legal routes? Does anybody want to take that question? Professor Martin McKee.
Yeah, it's very difficult to think that there would be, because Parliament is sovereign, it can decide what to do. And I think what we are hearing is that, well, in fact, this is a political decision. And of course, the FT, Sebastian Payne and others in the FT have described the political background as to why this decision has been made. But I think it would be very difficult. Well, first of all, we wouldn't be able to do anything in the time. But even with that, it's not clear what the grounds for any judicial review would be. So I can't think how one would go about doing it.
Thank you, Martin. Zubaida.
I'll let Gabriel go. I'll go. That's fine.
Well, there is one legal route, I think, that could help us a lot and deserves to be explored. And that is people's right to work in an atmosphere where there is fresh air. That's laid down in the regulations, and the HSE, the Health and Safety Executive, should be enforcing that. And I think COVID has changed. It must have changed our definition of what constitutes fresh air. And I think employers and trade unions and the government should work together to work out what that definition is, so that we all know it. And that may well involve not just improving ventilation, but it may also involve a requirement to wear masks at times. We don't know, because the work hasn't been done. And I think employees and trade unions may well be interested in taking legal cases about that legal right to fresh air in workplaces, which of course covers schools and universities as well. So if we want to get to a situation where there is acceptable fresh air in those indoor places where anyone is working, then now is the time to start putting the effort into doing that. And I think it may require a legal kick along the way to get the government to move on this, because they've been very dilatory in doing anything whatsoever about fresh air, about ventilation.
And we do know, we've covered this in previous briefings, that there have been a lot of complaints to the HSE this year, and I don't know how many of those have actually been dealt with. But it struck me the other day that the way that this is being managed at the moment is rather like, if you think about it as water, and you say actually the population has got to put up with drinking fetid water or being provided with fetid water, and it's up to individuals to boil their own water. We're not, as a society, going to make sure that your water supply is clean. We wouldn't stand for it. Zubaida.
Well, I actually am much more concerned about parliamentary democracy and whether we're in a democracy at the moment. I know that sounds like a very political statement, but the reality is there doesn't feel like there is any parliamentary democracy. I mean, quite frankly, the government is talking about opening mass events. We have had mass events under the guise of research events going on right now. We've got Wimbledon, we've got Euro 2020, we've got all of these mass events taking place, but Parliament is not coming together. And that really concerns me when you think about some of the coronavirus laws that have been taking place, when you think about the fines, and when you think about what the government is doing at the moment, which quite frankly is a mass infection experiment. And there's no other word for it. This is what the government are doing. And there doesn't feel like there's any opposition because Parliament isn't coming together. So it's absolutely right that you're asking, what can we legally do to stop this government? But frankly, I want to ask Parliament, why are you not coming together to discuss this? That something like July the 19th, where all restrictions, including safeguards like face masks and social distancing, are all going to be abandoned in the background of an incredibly rapidly increasing cases, where we've got over 30,000 cases a day, where hospitalizations are going up, where deaths are going up. It is an extraordinary moment, and I would like Parliament to come together right now.
Thank you very much, Zubaida. I'm going to move on now to some more live questions. We've got Sophie Ramsey, hopefully with us to ask a question. Sophie?
Yes, hello. I'd like to ask, I think it follows on quite nicely from what Zubaida just said, actually. The UK government's decision to remove almost every single mitigation against COVID, whilst cases are rising exponentially, is a way to guarantee further mutation and greater vaccine escape. Could this recklessness ultimately derail the entire vaccine programme? And if that is the case, does this have implications for the entire world and not just the UK?
Thank you very much, Sophie. I suspect there's quite a simple answer to this question. Who would like to take what seems to be a very complicated question, but I suspect has a simple answer? Professor Stephen Reicher.
Well, I mean, it seems to me that the decision undermines vaccination in three different ways. First of all, what many people have said, and I'm only echoing them, seems bizarre. Kit said it last week, that you can get to immunity in two ways. You can get to it through vaccination or through infection. And we're close to getting to it through vaccination. So why, when we're so few weeks away, have we decided to get to it through infection, with all the risks that you're talking about, all the risks of hospitalization, the risks of long COVID, the risks of mutation? Why take such an incredible gamble when we are so close to using the vaccines? It seems to throw away all the advantage of the vaccines. That's number one. Number two, one of the problems with what's happened is not simply the reality, but the rhetoric. A health secretary who can get up in Parliament and say, with insouciance, we might have 100,000 infections a day. One of the most remarkable statements I think I've heard is telling people infections don't matter. That's the message. That's the message of seeing 60 or 90,000 people all together. It's the message of so much that's going on. And if you say infections don't matter, then why on earth should you get vaccinated? That message, that really powerful message that it's all over, is undermining the vaccine program. We're seeing that at the moment. We're seeing that the number of vaccinations is halving, particularly in young people. And when you listen to those on the ground, they say it's because young people are saying, what's the point? So that's the second way in which vaccination is being undermined by this policy. And the third way is the way you describe, that clearly the more that you have a reservoir infection, the more reproduction there is, then the more mutations there are, and the higher the probability that something might emerge that could undermine the vaccine. So it's not just in that one way, it's in three ways that the government is throwing away the very thing that they claim is the best development in fighting this pandemic, and it simply doesn't make sense.
Thank you, Stephen. Martin, did you want to answer?
Yeah, just to add, no, you raise a really interesting point. It's one that I'm quite heavily involved in because I'm a commissioner. I'm also the rapporteur on the Pan-European Commission on Health and Sustainable Development, chaired by Mario Monti. And we'll be bringing out our report later this year. And we're dealing exactly with these issues, the idea of an international pandemic treaty and so on. And so actually just this morning, I was finalizing a paper which is looking at the concept of sovereignty in the context of a pandemic and the responsibilities of governments. And we do accept in many areas that governments are not able to act completely autonomously. And that can go all the way from the Genocide Convention to chemical weapons to all sorts of other things. So there are constraints, both whenever governments pose a risk to other countries, or even under the Blair Doctrine, as was used in Sierra Leone and Kosovo, when they pose a risk to their own populations, short of the Genocide Convention with the responsibility to protect. Now, clearly, if you are going to be a government that is going to be fostering the conditions that will let variants escape, I think this is a debate which is now being had. And in fact, later on this afternoon, some of my colleagues will be having, we are actually having that discussion with actually one of the leading world powers. And we have been having these discussions, and particularly within the framework of the G20. So I'd simply say, watch this space. There is actually quite an appetite for moving forward with this. And it actually spans many countries that you would not necessarily have thought would agree. And in fact, the last call I was on, I think it's fair to say there was only one country, not in Europe, and not in North America either, which objected. So I think that we're seeing movement on that.
Thank you very much, Martin. Sophie, thank you very much for that question. I want to get through quite a few questions because I can see them and they're really interesting. So I'm going to ask all of our questioners to keep their questions short and single. And I'm only, unfortunately, going to allow one person to answer each question. So sorry about that, but it means we'll be able to fit in more questions. This is one that I must read out from Janet Smith. She writes, Richard Horton, the editor of The Lancet, said he was saddened that Chris Whitty and Patrick Vallance are supporting the government's decision to lift all restrictions on July the 19th. The members of SAGE are also silent. Do you think scientists are failing the public at this time? Who would like to take that one? do we think that, should we say some scientists are failing the public at this time? Gabriel.
That's a difficult question to answer. And let me try and do it. I think there is a failure of the system for providing government with scientific advice. And there is a failure of the political system to separate the provision of that advice from the political decision-making system and the communication of those decisions. So let me deal with both of those very quickly. One, I think Mike Ryan spoke about immorality and stupidity yesterday, the director of WHO, when he was asked a question by the BBC about the UK government's approach to increasing cases during the summer and deaths during the summer, so as to avoid them increasing in the autumn and being a burden on the NHS. And I found that extraordinarily difficult. And I speak as someone who was on the GMC for 10 years and very much involved in the issues of ethics and fitness to practice, that those are difficult issues for a doctor to support, I would have thought. But I think not knowing precisely what evidence is being given to the government, it's very difficult to say what the scientists are saying. But that brings me to the second, and maybe the most important point. The Civil Service Code is quite clear about the role of civil servants. Their duty is not to get involved in matters of political controversy. Their job is to help ministers implement their decisions by providing them with good advice and helping with the implementation of those decisions. But it is not to defend government decisions. It is not to put themselves in a position where they are seem to be taking a controversial political position. And the reason why is because at any moment there could be a change in government, and we need a civil service that can serve an incoming administration just as well as it served the previous administration. And putting civil servants up front in promoting and defending government decisions is, I think, an abuse of civil servants and an abuse of our democratic system.
Thank you very much, Gabriel. That was extremely clear. I said I was only going to allow one person, but Sir David, I will let you come in here.
Well, thank you very much for breaking your rule. I just wanted to say, in answer to this very good question, are scientists failing the country? Of course, we are directing this at the scientists within government, and I was a scientist in government. I came into government just after the Phillips Commission report into the BSE crisis in the cattle population of this country. And that report was absolutely critical in the way I was able to function, because what it says, and I would advise anyone to go back and read just the brief summary of it, is what it says is that every department should have a chief scientific advisor. The chief scientific advisor should be parachuted in from, for example, the university sector, and should be an independent advisor within government. And that was accepted by the Blair government. This report was available towards the end of 1999, which is just into my appointment. And I had to explain to Tony Blair what that meant was that my advice that I gave to him, I would also have to put into the public domain if there was a public interest involved. Now, this is not in operation, and I would say has not been in operation since about 2010. It is no longer in operation. It was until that point, where a chief scientific advisor could simply go into the public domain and say, this is the advice I've given, even if the government hasn't followed that advice. And the way that I persuaded Tony Blair and subsequent prime ministers to follow this, well, actually one, Gordon Brown, was simple, which is, if the chief scientific advisor keeps the trust of the public and also keeps the trust of the cabinet, then you have the best of all possible worlds. I'm afraid that is no longer in place. And what we see, the way the advice goes into the public domain, is the Prime Minister or a Minister of Government standing flanked by people who are considered clearly to be junior to the person who is a minister. So I think we've broken the Phillips Commission reports advice once again. That BSE crisis could have been really dreadful in terms of the number of human lives lost. Fortunately, the scientific community did manage to overcome the advice given by ministers, and that advice was given saying, we are following the advice of the scientists. But if that advice is not in the public domain, how do we know? And I'm afraid that's the position we're in now.
Thank you very much, Sir David. That's extremely clear. I'd like to invite another question now then from Ludovico Roy. Ludovico, are you with us?
Yes, I am. Thank you for having me, first of all. My question to you will be, there has been recently an announcement from the Secretary, Sajid Javid, that those fully vaccinated citizens would not need to self-isolate if you're in contact with a positive case. My question to you will be, what are the risks of this choice and how we can mitigate them? Thank you.
Thank you very much, Ludovico. So who would like to tackle that? What are the risks of not imposing quarantine if you're fully vaccinated? One person. Who's it going to be? Martin?
Yeah, well, I mean, we simply need to look at the situation in Israel, where there's a very high level of vaccination, and there have been a number of people coming in one case from London, who then transmitted the Delta variant onwards. So there is a risk associated with it, because we know that the vaccines are great and they're very important, but they're not 100% effective. So I think, yeah, there clearly is an increased risk associated with it, but the calculus, of course, is rather complex because of all the other factors involved.
Thank you very much. And a question to read out now. So sorry, it was a short and sweet, Ludovico, but a question to read out now from Shelley Gray. What is the plan for young children who are at higher risk from COVID? Is there a plan for younger children who are at higher risk? Professor Anthony Costello.
Yeah, can you hear me okay?
Yeah.
So this morning there was a paper released about data collected by 4 universities about the effects on children over a 1-year period. And it showed 5,800 children were admitted with the virus. 690 had this rare inflammatory condition called inflammatory multi-system syndrome. 50 of them required intensive care. 25 died from COVID and 61 had died with COVID. And the conclusion was it's extremely low risk in the BBC report. From those figures, that looks to me like a measles epidemic, and we would certainly vaccinate against that. So I would disagree with that interpretation. But additional to that, and the reason I would support strongly vaccination for children 12 to 17 is the issue of long COVID as well. We know that about up to 14% of that age group will get symptoms lasting longer than 12 weeks, self-reported, admittedly, but a third of them will lose taste and smell, which suggests that their brains are being affected in some way. And again, if you do back of the envelope, you know, if half of that age group develop loss of taste and smell, then I worked out around 80,000 kids would get that. And the reason one's worried is that some very good studies of adults recently have shown thinning of the brain cortex in the taste and smell area if people get these symptoms. But more than that, the issues we've discussed, children will be an incubator for dangerous new variants. They will circulate the virus, so they can be a threat to people who are much older and more vulnerable. And being vaccinated, look, I'm doubly vaccinated. I've just had COVID for 10 days and I'm still not better. So, I mean, I'm well aware of how nasty this can be, even for people who have been vaccinated. We also know that natural infection is less good than immunization at giving protective immunity. We know all about the damage to education from people being off and all that. And we've got good safety data. So the US approved this in early May, the Europeans in late May, and we approved it actually at the beginning of June. Now, MHRA. And so why are we not doing it? Well, the JCVI has not decided yet. And I'd like to throw, since we're now pursuing libertarian public health, I would argue that if Sajid Javid is a libertarian, why is he stopping parents from having access to an approved vaccine on the basis of a few decisions of people at JCVI? I'm hearing whispers they may not approve rolling out the vaccine. So I look at the same data with a different lens, and I think quite a lot of people do. I think children should have the right to have access, particularly in the 12 to 17 age group, personally. And I think that's a very important thing if we're also going to reach herd immunity.
Thank you very much indeed, Anthony. I think we've almost run out of time for questions now, but I'd like to invite Zubaida to ask questions of our special guests before we finally wrap up for today. Zubaida.
Hi, Tamsin. Are you still with us?
Yes, I am.
Tamsin and Alma, I was very interested in what you were saying about this summer and how after a brutal year, and Alma, you really brought this home, after a brutal year for children and young people of having to live in, having to endure lockdown, of having to endure disrupted education, of not meeting their friends, of having, quite difficult relationships because they've been off school so much. I was very interested in your solution about having more activities in the summer, free activities for children, because one of the other things I've seen through research is that this pandemic has disproportionately affected children in areas where there is not much green space, for instance. Do you think this is something that we should be pursuing with this government? And also in terms of the mental health services that you were saying, do you think as of September, the government should be bringing into school more services where children will be able to talk as a whole about the impact of this pandemic on them?
Well, those are both very good questions. We start with the activities. There is a small but growing and interesting literature on access to natural space and mental health. And it's bearing out what many of us just feel, that, that if you can spend time out in nature, people talk about the green gym or the blue gym, and that is harder for some people. But, to use a fallback on anecdote, I have a very good friend who's a nursery school teacher. He used to do forest school in Peckham. And she could find enough green space to, and check it all out before she took the kids out to do planned, structured activities in Peckham. So I think access to good quality open air projects are perhaps harder in our deprived inner cities, but they're not impossible. And we should be, if it can't be outside, it could still be somewhere with good ventilation and a bit of structure and some physical activity and some, some fun with other kids. So I think that's what we could all do with, but particularly children and young people. In terms of services, there was a green paper with a consultation and response, which one of the main planks was bringing schools and child mental health services closer together. So every school should have a mental health lead amongst the school staff, but we need to think about how they will be trained, and school mental health teams were being set up. But the aspiration was only to cover 1/3 of the country by next year. It's not good enough. What about the other 2/3 of the country? So we need to expedite and expand that. And I think it's really all hands on deck. You can't turn teachers into therapists. They're too busy being teachers, but we can support them to help with the more minor transient problems. We need to get smart with self-help materials and skill up parents and youth leaders and other people who interact with children. But we do also need to expand the trained workforce be they in the third sector or these school mental health teams or within classical mental health services.
Thank you, Tamsin. And that just brings us back to what Alma was saying right at the beginning, when she was saying, look, I've been talking about this for months and I'm not seeing any action, and we need to actually see some actions in place. Alma, do you want a final word?
I mean, with what's been said about like natural spaces and things like that, like definitely for me, especially being so close like to some woodlands, like it was a really big help for me going out, you know, a big reliever like of stress and all things like that. I feel like during the summer and when kids go back to school in September, like having these free activities and these mental health services available to them, I think will be very beneficial to get off hopefully to a new start. A better start this winter.
Thank you so much. Thank you, Alma and Tamsin, for joining us today as well. I'm going to hand over to Sir David for a brief summary and final word. Sir David.
Well, thank you very much for once again giving me this brief summary period. But all I want to say is I've learned so much from listening to my colleagues, and I very much hope that not only the media, but the policy makers will listen and take these points on board. All of the points that have been made are so critically important as we run towards a potential of 100,000 cases being allowed to continue to grow in this country. I think it's a critical time for us all, and I hope that we will see a good policy begin to emerge now, because we're running out of time.
Thank you very much, Sir David. Thank you to everybody who's been watching, whether you're watching us live or catching up. I want to thank again our special guests, Tamsin Ford and Alma Jubaili, for their precious insights on mental health in young people during this pandemic. Thank you to all of the scientists of Independent Sage, as always. All of them are volunteers freely giving their time because they believe that there needs to be this open communication between scientists and the public, especially during this difficult time in all our lives. It's important to be able to share data analysis and scientific opinion, but it's also important, as we've heard today, that scientists are listening closely to the public and understanding their concerns. All of the reports that Independent Sage has produced on all sorts of aspects of the virus and the pandemic are on the website, along with details of all the scientists. Please follow Independent Sage on Twitter if you don't already. We're on Instagram too. And we'll be back same time, same place next Friday. Stay home if you can. Stay safe. Keep well.
Thanks, everyone.
Bye.
Bye.